So tell us your name.
Hi. So am I talking to the camera? All right. My name is Erica Ciaraldi. I'm with Qualcomm, specifically Qualcomm Wireless Reach. We are a Tech for Good initiative at Qualcomm, which is a technology company. And we're excited to be here.
Awesome. Well, and I know you're a sponsor and you've had quite a bit going on. You presented this morning, you had a session this morning, and you have partners here. So maybe do you want to tell us a little bit about the partners and the work that you're doing with them?
Sure. Oh, okay. All right. It's heavy. So we are a sponsor. We had a session this morning on optimizing the use of digital tools to improve health outcomes. We have a couple of partners here from around the world. We work with a really wonderful organization in South Africa called Zoe Life Innovative Solutions. They work with pediatrics, so children and adolescents who are living with or at risk for HIV. And they have a really exciting gamified suite of digital tools and applications. And then we work with actually the George Washington University Medical Faculty Associates, so just down the road in Washington. And we have a really interesting telehealth program with them as well. So both of our organizations were presenting here today, really talking about their very different contexts, end user populations and geographies that they're working with, but they've experienced really similar barriers to the adoption and implementation of digital tools and skills, really. And so we thought it was a really nice bridge between the organizations to look at the really the solutions that they've found that work to overcome these barriers. And the biggest barrier that we see is really digital health literacy. So that's literacy, digital literacy, health literacy, and then you combine all of them, and we're seeing a lot of barriers in terms of uptake of health-related tools. People don't have a problem using WhatsApp, using Facebook, but it comes to health, we were discussing how it all of a sudden becomes a lot more complicated. And so how can we use the tool in our hand, be it a phone, tablet, and really augment those with by training health coaches, by really making sure that we're designing for the end user our solutions to really try to enhance that adoption and hopefully lead to those improved health outcomes.
Yeah, that's great. And so, Erica, maybe tell us a little bit more about kind of Qualcomm and the role that you see Qualcomm playing in the global digital health landscape. You know, you obviously have a couple of partners that are here today. I saw the GW folks, the lab folks yesterday. They were demonstrating an AR solution, right? That was really innovative. But maybe kind of talk about the connection to how does Qualcomm sort of see its role in this broader community that's convening here.
Yeah. No, it's a great question, and we're kind of getting back into the health space. But so Qualcomm, for those who aren't familiar, we like to say we put the smart in your smartphone. So we invented those foundational technologies that connected the phone to the internet, and then we did a whole bunch of other things. And so I think a lot of the solutions that you're seeing here are really built in some way, shape, or form on some kind of Qualcomm-enabled solution, whether it's GPS, Wi-Fi, Bluetooth, chips that run AI systems, things like that. And so, but we also know that we can really use these innovations to catalyze some kind of social impact. And so that's what Wireless Reach does, is how can we take these innovations, these wireless technologies, and bring them around the world, to the communities and the individuals who can be impacted most by these solutions. And so we work in the areas of education, healthcare, public safety, and so on, but education and healthcare are our biggest. I think a big role that we have to play here is really just trying to help identify organizations that are doing really promising things, where we can also bring in some of our technical expertise as well as resources, but to leverage some of that technical expertise that we have as a company. And I think, there's a lot of exciting opportunities out there for public-private partnership and different forms of collaboration. We're seeing lots of different ways that people are bringing, folks across the ecosystem together. We know that it doesn't work to, unfortunately, just have government, just have private sector, just have, civil society. And so how can we bring all those folks together? And so we're really excited to be part of that ecosystem. And I think we can bring some of the other relevant stakeholders to the table as well. So I think that's probably, hopefully, a good role for us.
That's great. Well, we're so thrilled that you're here this year. You're back, right? Yeah, you're back. And you had been a part of the global digital health community yourself, and you're bringing Qualcomm kind of back into the mix. Yeah.
Yeah.
Great. Well, thank you so much for being here. And thank you, Qualcomm, for sponsoring this session. And we will see you around.
And hopefully next year as well.
Great. Thanks.
Thank you.